Eating the runway, serving the runway climb. Eating the runway, yes. Turning, eating, serving, slaying, eating the runway. Judges, Tim's across the board. The next bitch, let's go. Eating the runway, yes. Serving the runway here. Eating one at a time, baby. One at a time.
We just come here, go on some music, chill, dance. It's a nice escape from our everyday lives.
People just letting out their emotions and, you know, they're just being wild. Wild is fun.
I mean, it seems like it's more fun to hang with people that are out about everything and enjoy doing stuff like that.
I think the last two was in the runway.
My name is Brazil. My mom was diagnosed with schizophrenia. It got really, really bad to the point where like she would physically abuse us. Our teachers were seeing bruises and scratches all over our body. I remember like it was yesterday, I remember being called down to the office after school and like this strange lady and man was there, told me that I couldn't go back home, and I wound up being taken away from my mom that night. I got placed with an aunt of mine. That was a horrible situation. She had a lot of foster kids and it was like a lot going on there too, which led to me ultimately running away due to being abused and stuff like that. So I ran away at the age of 14.
Positive, positive. What to do about a positive? Fear, hatred, anger, horror. How can you do this to me? How can I do this to myself? How can he do that to me? I've always had a plan for my children. Now I can never have them. Now I'm just another statistic. Walking and walking across the bridge to confirm the results. Slow feet, slow movement, anger and phone calls, disrespect through text. But I've been faithful, or the lies he tells. Tears roll down my cheeks. What if I am positive? Silence fills the void in between him and I. I hate you, I think. I let my mother and father down. Sitting in this room, watching the clock, waiting for the time to pass by fast. Anxiety rising. Kara Roberts. The nurse calls my name. I walk back the dreaded walk. Deep breaths, pinch. 20 minutes, we'll be back. Deep breaths, silence, cold stares. Thank you, God, I am not positive. Thank you, God, for opening my eyes. Walking back across this bridge, there's no trust. This relationship has to end.
When I moved here when I was 13, I started meeting a lot of different people. I started understanding myself a lot more. I knew there was something different about me. And I started to venture out a little bit. My parents found out. They were very devastated. They were very angry with me. And I ended up being very homeless. Going from house to house, home to home. Sometimes I even slept outside. And then the word about me being gay got spread around town. So I got bullied every day. I had to fight every day. One point in time where I had 40 bottles and rocks thrown at me on every day going home to school. It was very humiliating and very dangerous for me. And although I'm tough, I just didn't want to keep going through that.
Then I turned 16 and Project Silk came around.
Eventually, you know, I got educated about prevention. I started doing a lot of work with Planned Parenthood, Pitt University, Community Human Services.
I met a lot of people who were like me, who were interested in the same thing I was interested in, and it was a more comfortable place for me to actually find myself.
I'm glad to know that I had the strength to carry on through all of that drama and all of those trials and tribulations.
Honestly, being at Project Silk, it really has like opened many doors for me that led me to where I'm at right now.
I didn't let people bashing me and putting me down stop me from being the person that I am today.
I'm no longer homeless. I have my own place. I'm currently working at Project Silk.
I feel like today I've been pretty successful and I made a big difference. And I really, really hope that I continue to do the same for as long as I can.
My name is Dalen Hooks. I'm a medical case manager at Central Outreach Wellness Center. Basically, our case management department helps people get linked to housing, any social service needs, insurance linkages. We also work with the Pittsburgh ballroom scene. Through that, we do outreach. We offer testing at some of the events. The ballroom scene is an underground competition where people can come and compete for prizes and trophies. It derived in New York City many years ago as a safe haven for people who identify differently, who were drag queens, trans, all different kinds of folks would come and compete underground for fashion and runway and Vogue and many different categories. Outside of work, I am Mayor Dalen Ebony. I am an overseer in the iconic House of Ebony. I came into the ballroom scene in 2009. From there, I kind of grew into leadership because of the social work that I was doing in my personal life kind of spilled out because I seen so many people with a need. So I started to talk to my job about doing outreach into the ballroom community, and from there I started throwing events and hosting testing events and different things like that. So over the years I kind of stopped walking balls and became more of a ball promoter. I think that it's very important that we continue to support ballroom events and other events that kind of bring this marginalized community out, because if we really want to meet that AIDS-free quota, this is one of the biggest at-risk communities, and this is where a lot of the work needs to be done.
There is a difference between a doctor and a healer. A doctor is somebody who can prescribe you medications. However, a healer is somebody who knows her clients, who knows them by their names, and who knows their personal history. And that besides giving them a medication, she tries to make them well.
Many times, treating the HIV virus itself is just a really small part of what we're trying to do. Being undetectable is easy for most people. It's just one pill a day. It's easy if everything else in your life is stable. So if you have stable housing, if you have a job, if you have money in your pocket, if you have food in your belly, if your cell phone's turned on, the reality of it is all those other barriers get in the way and become usually more of the problem than the virus itself.
Stacey Lane, she's amazing. She saved my life, really pulled me out of the darkness, and if it wasn't for people like her, then I definitely would be under a bridge somewhere. Fortunately, when I was 23, I contracted HIV during prostitution and, trying to survive. But at the end of the day, I'm here, I'm still alive, and I'm still well, and I'm trying to give back to my community, help them as much as I can.
When she told me that she was going to put this van and that she wanted me to be in charge of it, I said to her, the place has to be very beautiful because it has to be like a sanctuary for healing. And secondly, we have to go where the patients are. If there is something that we have learned from HIV is that you have to go where the disease is moving. I said, let's take this van where people are meeting up, where people are drinking, where people are hooking up to have sex, because that's the place where the virus transmits.
My medicine that I practice is pretty unconventional, and that I like to meet people where they are. And the idea was to bring the medical care to the community rather than asking the community to come to the medical care. The outreach van has been very powerful because we get to meet a lot of people we probably wouldn't normally meet and let them know about our services.
I was diagnosed HIV positive around the time of 9/11. When I was starting my graduate school at NYU. It was a completely different time. At that time, it was just when they were rolling the medications in. So I have experienced throughout my almost 18 years of history with HIV, a lot of changes. And I think that what we are doing is transforming for the people. And my goal is that we are gonna bring the viral load of the city of Pittsburgh to zero. I've said many times to Dr. Lane, I intend to do it, and we are gonna do it, and I have seen that day. That day is coming. And it's gonna come with efforts like this.
My hope for the future of my practice is to make our practice accessible for everybody. The barriers in healthcare just don't work in the current system. So I think if we're gonna make healthcare truly accessible, we have to meet people where they are. Rather than trying to fit people into your box as a medical provider, we have to change the box so that it fits other people.
My name's Alan Jones. I've been at Allies for Health, which was the Pittsburgh AIDS Task Force. I've been here almost 27 years. I know, wow. I've been doing testing and counseling for the last almost 18 years. And in terms of, I've been asked what it's like telling someone they're HIV positive. And I remember a young man, this story always sticks in my mind so well, this particular incident. It was probably a good 15 years ago, and the guy had come into the office. He was 19 years old. He was a gay male, very sweet guy, just a really nice guy, nice kid. And he came in, and I unfortunately had to tell him he was HIV positive. And just to put this into context, this was a time when it still, for many people, was considered the death sentence. A lot of the medication and treatment wasn't quite where it's at now, by far. But anyway, I still remember telling him this, and he looked at me, and he goes real quiet, and then he started to cry. He actually started to sob. And he was sobbing so hard, and he looked at me and he said, "Can you hug me?" And I remember getting off my chair and kind of sitting over beside him. We had wider chairs, and I put my arms around him, and he just cried and cried. And there's no way of sugarcoating that. I couldn't tell him this is all going to be okay. And I remember the irony of all this is that all of a sudden his cell phone went off, and of course it's his mother. And he was so upset. He picked up the phone and he said, "Mom, I was just told, I'm HIV positive." And he said, "I'm going to get AIDS." And he started crying. And of course, his mom started crying, and she kept saying, "What? What are you saying? Where are you at?" And he was unable to talk anymore, and he handed me the phone. So here I am, 2 weeks before Christmas, telling a woman that her 19-year-old son was HIV positive, and all she heard was he has AIDS. And just what a hard moment that was for all three of us. The irony of also this is about a week later, I always can remember this, I get a call one afternoon. I take the call at work, and it was him again. And he said, "Alan, can you do me a favor?" He said, "My mom and I were putting up the Christmas tree, and I can't get her to stop crying. Can you please talk to her?" It's interesting, people say to me, "Well, what's it like telling someone today?" And I have to say this. The big thing here is when I first had to tell people they were HIV positive, it was a horrible moment, even for me. I couldn't tell you how many times I would even get in my car afterwards and have a tear moment on the way home just because the person had me so worked up just with all the emotional issues that were going on. It was about, just some damage control here and crisis intervention. But it's interesting now for me to tell someone because someone who's told they're HIV positive today probably should have an average lifespan that will match most anybody else's. The secret here is finding out early. The secret is getting into care. And if you do those two things, you can prevent infecting somebody else, you can remain healthy, and there's no reason a young person who finds out they're HIV positive today shouldn't live to be 75 years old and may well end up dying of something else that's not even related to HIV, and I'd like to make that very clear.
We first opened our doors in 2014, and we have learned over the years on how to improve it and make it the best to our availability.
Our specialty pharmacy, I feel like, prides itself on being personable with all of our patients. Not only HIV, but we do oncology, transplant, all of our disease states. You are talking to the same person at Giant Eagle.
I guess everyone at Giant Eagle knows when they see an HIV prescription that it's a very important patient. So they'll come over to me, and I'm always checking regimens to make sure it's correct, because I tell my patients, HIV is just like treating blood pressure. You have to take medication to control your blood pressure, and that's the same thing we're doing here, is we're taking an HIV medication to work on the viral load. We treat any copay, whether it be $20 to $1,000, we want to get that to zero. That's our top priority. We also like to communicate with providers when any patients are having any issues. I feel that HIV patients, I just have a certain bond with because they have opened up to me and provided me with a background on their life that has given me so much appreciation and knowledge that I can provide to my daily life. And I just want every person to know that Giant Eagle has invested into this program, and I really look forward to the next 4 to 10 years to see where we can go and what impact we can make on patients' lives.
Hi everyone, I'm Ken Ho. I'm an assistant professor at the University of Pittsburgh in infectious diseases and HIV. I'm an HIV specialist, so I take care of patients at the clinic here. And I started up the first freestanding PrEP clinic in Pittsburgh probably around 2013, right after PrEP was approved. So let me take a second to explain what PrEP is. PrEP is short for pre-exposure prophylaxis, which is a means of preventing HIV using medication given before a high-risk exposure. Here we have a medication called Truvada. It's a combination of 2 HIV medications, and it can be taken once a day, and it's been shown to prevent HIV really quite effectively. Being that it's HIV medication, what it does is it prevents the virus from replicating, and it is actually used to treat HIV as well. So more recently there's been this concept of U equals U. It stands for undetectable equals untransmittable, and I think for a long time, we've been treating people who are HIV positive. What we do is we put them on medication. We watch as their viral load, the amount of virus in their blood, basically goes down to undetectable. And when it gets there, the question is now what? If people who are undetectable, could they transmit HIV? But now, after a lot of research, a lot of different studies, I think we have evidence, really strong evidence, that basically if you are undetectable, that you cannot transmit HIV to somebody else. I think that really helps to reduce stigma against people who are living with HIV and AIDS. With regards to AIDS-free Pittsburgh and the whole concept of getting to 0 AIDS infections, we have so many things on the table. We have U equals U, we have PrEP, and we have kind of a whole body of research that's looking at new options coming down the line as well. We have clinical research which is looking into, for example, the concept of topical PrEP. So instead of taking a pill once a day, maybe this is something, a medication that could be in a gel that could be used as part of a lubrication that would be used during sex. And this is something that you wouldn't have to worry about side effects as much. It's something that you could just use when you have like a risky exposure. As a doctor, it's not about what I want the patient to do, it's about what the patient can do for themselves and to be able to give them options to protect themselves. I think the important thing overall is people need to start having conversations about HIV and about risk and speaking to their friends and to their doctors in kind of like a comfortable, safe setting, like, am I at risk for HIV?